Today I will discuss about absent or reverse MCA diastolic flow. So what do you think about this Doppler waveform? We are seeing absent or reverse diastolic flow in the fetal MCA. But does this always mean pathology? The answer is no. And this is where an important mistake can happen in fetal Doppler interpretation. Normally, the fetal MCA shows a high systolic velocity while the diastolic component is relatively small. For example, the systolic velocity may be around 40 centimeters per second, while the diastolic velocity may be only 5 or 6 centimeter per second. Now, if the PRF is too high or the wall filter is not properly adjusted, the small diastolic component may not be displayed properly. The waveform may then falsely appear to have absent diastolic flow, but a pseudo-reversed appearance is a different issue. In difficult scans, excessive proof pressure, compression of the vessels, or suboptimal acquisition can alter the waveform. This may produce attenuation or an apparent reversal of diastolic flow. So, when do we see true pathological reverse diastolic flow? Interestingly, typical fetal hypoxia does not usually cause reverse diastolic flow in the MCA. Instead, fetal hypoxia classically produce the brain sparing effect. The cerebral vessels undergo vasodilatation, cerebral vascular resistance decreases, and the MCA diastolic flow actually increases. So, seeing reverse diastolic flow in the MCA does not automatically mean fetal hypoxia. Persistent true reversal is rare and depending on the clinical situation may be associated with severe intracranial pathology such as intracranial hemorrhage, severe cerebral edema, markedly raised intracranial pressure, or terminal fetal compromise. That is why before labeling a waveform as absent or reverse diastolic flow, always check the technique first. Reduce the PRF, adjust the wall filter, release excessive probe pressure, make sure the vessel is not being compressed. Optimize the baseline and scale, then repeat the waveform. You can also evaluate the contralateral MCA. If the abnormality persists, correlate it with the umbilical artery Doppler, ductus venosus, fetal growth, biophysical profile, and intracranial findings. Because one incorrectly interpreted Doppler waveform can potentially lead to an unnecessary emergency delivery. And unnecessary prematurity can have significant consequence for the baby and the family. So remember, don't just look at the waveform. Check the technique, understand the physiology, and then make your interpretation. Because fetal Doppler is not just about seeing a waveform, it is about physiology, technique, and clinical judgment.